Today, we will likely hear a consistent drumbeat of sobering statistics which underscore the often life-threatening, too often fatal experience of birthing while Black. Now, while some may be tired of hearing these alarming data points, they should know that Black people are tired of living them, and more accurately, tired of losing loved ones. My paternal grandmother, whom I never had the blessing to know, died in the 1950s, giving birth to my father's youngest brother, sending my father and his 5 siblings into a downward spiral of great trauma and hardship. And decades later, the Black maternal mortality crisis is still killing our loved ones and destabilizing our families.
That was Congresswoman Ayanna Pressley speaking today at a House hearing on America's Black maternal health crisis. Ironically, I have the same exact story in my own family. I also lost my grandmother in childbirth. We are one of the wealthiest countries in the world, and yet America's maternal mortality rates are some of the highest in developed countries. And they're especially high among Black women. Many women develop severe pregnancy complications that can have serious consequences for women's health. Most pregnancy-related deaths are preventable, but Black women are 3 to 4 times more likely to die from a pregnancy-related cause than white women. Black women also experience higher rates of pregnancy complications, infant loss, and miscarriage. Just as Congresswoman Pressley said, this doesn't just hurt the women themselves. When a Black woman dies in childbirth or pregnancy, her family can go into a downward spiral from hardship and trauma. Joining me now is one of the experts who testified today at that hearing. Dr. Joya Adele Creer-Perry is an OBGYN and the president of the National Birth Equity Collective. Thank you so much for being here tonight.
Thank you for having me.
Lay out for us the maternal health crisis facing Black women in the United States right now.
Well, we know that Black birthing people are more likely to die in childbirth. In fact, the CDC showed that even when we have an education of a graduate level or higher, we are still 5 times more likely to die in childbirth than our white counterparts. So the problem is not that we're not educated or we're not healthy. Even when we are normal weight, even when we receive prenatal care, even when we have wealth and income, we're still more likely to die. And we know that that happens due to things like hemorrhage and hypertension, but mostly because we are ignored, we're disrespected, and we're not valued. So when we show up with symptoms like Serena Williams and others who have great potential and opportunity, or like today's presenters, we realize that despite those things, we're still not listened to, and so therefore we're more likely to die within a year of childbirth.
So how does this play out in real life? Because, I mean, even folks at home that may not have firsthand seen this happen or had a lot of experience in a hospital, how does this type of thing happen, right? We're in the richest country, as we said in the intro. I don't know that there's, nurses and doctors that are overtly, discriminatory, but how does this actually play out so that Black women have worse outcomes?
Well, I mean, one of the colleagues that's presented with me today was Charles Johnson, and he tells a compelling story of his wife, Kira Johnson, who spoke multiple languages, they were planning the pregnancy, they were married, all the tropes that you hear about why Black women die, they meet none of those things. And yet they went in for a scheduled repeat C-section, and with hours after the C-section, he noticed that there was blood in his wife's coming out of his wife's bag, out of her urine. And so he called the nurses and called the attention, and it took at least 10 hours between him consistently saying something's wrong. They ordered a CAT scan, did not happen. And eventually, by the time they took her back after midnight to look inside of her abdomen, she succumbed to having a bleed inside of her abdomen that was not addressed. So that lack of attention, that lack of care, that lack of being a priority. In fact, the nurse told him when he advocated for his wife, well, your wife's just not a priority right now. And that statement haunts him, and it haunts all of us. Like, we should be a priority at all times. And if you can't see that we're important enough to at least address our pain, our bleeding, then we're going to have to fight back to show that we are important, that you should address those things.
What does the United States need to do to prevent Black women dying or suffering these types of problems? I mean, is it just, making sure that if you are a Black woman who is giving birth, that you have an advocate in the room at all times, no matter what, so that somebody is going for 10 hours and nagging the nurses and the doctors to do something? Or is there a more systemic way we can actually improve the treatment of Black women?
Well, Selena, we know that across the world, Black people are treated poorly. And we know in the United States, women are also not valued. So it doesn't matter. We have the worst outcomes in the world when it comes to maternal mortality, not just because Black women are dying, but because we don't value women's lives. So we are asking for the White House to create an office of sexual and reproductive health and well-being so that we can look at all the different places that shows up when it comes to equal pay, paid leave, access to job protections, all these things. There's not one small answer. It's really undoing all the harms that have been to our bodies when it comes to both gender and race. When you put those things together, that's why you see a higher rate in Black women.
So because of this problem, more Black women are doing what you have already alluded to, which is trying to figure out alternative ways other than going into a regular hospital. So midwives and doulas helping Black women deliver babies in safe conditions at home. Is this something more women should look into? I mean, it just sounds scary. I've never had a child. I'm pretty afraid.
I honestly, what we want to stop doing is scaring people. We want people like you who are smart and beautiful and amazing to have babies. We do. Black folks deserve to thrive and be in the future, but we also want you to be protected. We're powerful and not protected. So yes, you should have an advocate with you. You should not go to the doctor's appointment alone. So if that's a partner, a doula, a support person, a cousin, a sister friend, please ensure that. But our job as an OBGYN, my job as a policy and an advocacy person is to ensure that you don't have to always fight for yourself. We need to make a system and a structure that says, we just value you. We value your choices. We see you as fully human, and we want to invest in you. So that's the work that America has to do to internally and around to ensure that we don't cause harm to the people who live here, but even the harm that we sometimes do around the globe when we perpetuate this idea that our job is to police and control instead of just allowing for justice and joy for all people.
Justice and joy for all people sounds like a mission that I can definitely get behind, for sure. Dr. Joya Adele Crear-Perry, thank you so much for being here. It was a great conversation. Please stay safe. Hi, I'm Zerlina Maxwell. Thanks for checking out our channel on YouTube. You can see more from Zerlina by clicking any of the videos on this screen, and make sure you subscribe below to stay up to date on the day's biggest stories. Thanks for watching.